So, what can you do to prepare for your lung cancer surgery and to improve your recovery? Well, this is a very important topic and can sometimes be overlooked. In general, better health prior to going into surgery indicates a better recovery process. One of the first things to consider is if you are smoking, it's best to quit smoking at least 3 to 4 weeks prior to surgery. And this also includes vaping or any other inhalation products. It's important to stay active with walking, exercise, and doing whatever you would typically do to stay active. Also, deep breathing, using the incentive spirometer, which is a breathing machine that helps you expand your lungs. This is something that we usually give out at our pre-op visit, or you can also get it over the counter. But this basically is like a lung exercise and helps to improve your lung health. It's also important to pay attention to your nutrition. Eat healthy, concentrate on getting more protein, avoid alcohol, and avoid any junk food. These are things that will help with your recovery process. Also, it is a daunting time for most patients having a new diagnosis of lung cancer and having to go through surgery. But it's important to put things into perspective and stay positive as much as you can. Stay connected with the people that care about you, that are your support system, and stay connected with your care team. We are here to help you and address your questions and help with anything that's going to better prepare you for surgery. This is also the time to discuss prehabilitation or prehab. Typically, we talk about rehabilitation, which is making a person stronger and recover better after a surgery or after an illness. Prehabilitation, on the other hand, is done in anticipation of a patient going through surgery or going through a procedure, which could take down their reserves. So improving your reserves pre that procedure will help you recover after. And this is something that we do in our clinics and also in the pre-op clinics to identify patients that might benefit from this prehab. And we refer you appropriately to either lung prehab or pulmonary prehab or nutritional prehab or a prehab clinic where they can focus on some of these things to help you make a better recovery after surgery. After surgery, we pay particular attention to pain management and getting you back to your baseline. So in the hospital, you are constantly assessed for adequate pain control. Also, at the time of discharge, we make sure that you're going home with good pain medications that control your pain and better help with your recovery. We recommend that you continue making small movements every day. So getting up, walking around, doing a little bit more each day, continuing to use your incentive spirometer, which is the breathing machine, that breathing toy that helps expand your lungs. We also have you assessed by physical therapy and occupational therapy while you're in the hospital, and they make recommendations for you to take home that helps with your recovery. Sometimes there might be outpatient physical therapy involved, and we make arrangements for that. You will also get instructions on keeping your appointments and scheduled visits, which is the time that you will get to readdress some of these questions.